Hi, good morning, Mr. Johnson. My name is Anthony, and I'm from the respiratory care department as a respiratory student. So first is I'm gonna wash my hands. So after washing my hands, so would you mind if I'm going to check your ID band? Okay, very good. So after that, it will assess you. I'm going to listen for the breath sounds and also check the monitor for SpO2, heart rate, and blood pressure. So what I'm going to do here is that I'm going to do a breathing treatment and therapy. So the treatment that the doctor ordered you is how to help you in expelling your cough and also to improve your cough reflex. So the device that I'm here is the acapella. So as you can see, this is the acapella device. So first is that we always ensure that we will set the pressure or the resistance in the lowest setting like this. We always ensure in the initial setup we have to set it up in here before doing it to the patient. So before that, we're going to insert it in a mouthpiece, and then we're going to show it to you how to perform this procedure. So first is with the mouthpiece, you always make sure that we're going to seal it with our lips tightened, and then our tongue should be below. And then with that, I'm going to position you first in an upright position to make sure that you're going to do this the exact way. And then once inside, all you have to do is that you're going to take up slow deep breaths like this, and then after that you exhale in a strong manner, but don't do it in a forceful way because it might cause you any complications. Okay, so we're going to start it with our first trial. So take a slow deep breath and then exhale in a strong manner, but not in a forceful way. Now, so every time you do this one, I will allow you to rest for a few seconds, and if you're able to cough, you can expectorate. And then in using this one, we can do this one in about 3 to 4 times. And then because the patient just came from a nebulization treatment, it is very ideal for doing this one, especially the secretions are being helped by this to expectorate more. So there's other cases like this, especially when I try to do this one for 3 to 4 times to this patient. Whenever you notice some patients, especially the elderly, you can also either use it with a mask if they are unable to tolerate to make a tight seal. And then another thing is that because the patient would be using this one when they're being sent at home, we can also instruct them and then give them appropriate instructions, and then we're going to put this one in a safety bag like this. And then also another thing is that with this device, it is contraindicated that we have to do this together with a nebulization treatment because the flutter valve in here would lead to clumping. So it is very much recommended that we use this device every after nebulization treatment. And then another thing is that Mr. Johnson, with this one, even though you're taking up nebulization treatment, I would also let you do this perform every hour, at least 3 to 4 times, so that your cough would improve later on. It could help you expel more secretions. So aside from what I'm trying to explain is that this device, it is not also ideal for this to be washed, especially it is not recommended. So all you have to do is just put it in a safety bag. So every time you do this treatment, after that we wash our hands, and then we reassess the patient every time we do those treatment. Make sure we observe if the patient are having any dizziness or any discomfort every time doing this treatment. And then we also make sure we check their vital signs, and then once we're done, we have to go outside and then document everything. And then we also have to take note if the color, the consistency, and the amount of secretions that the patient was able to expel.